Hello. Hello.
Hello, madam.
Hello. Good morning.
Good morning,
Hello,
ma'am.
madam.
Okay. Okay, so let's go through quality management. Quality management. As you work in the hospital, patients who come to the hospital, their relatives, they demand what? Satisfaction, quality care. They demand quality care. So what is quality? So at the end of this lecture, you'll be able to define quality and quality assurance, the perspective of quality, explore key principles and processes of quality, discuss quality. Highlight the role of nurse and midwives in ensuring quality. Patients often complain. You already know that in the world, many patients or their relatives, they complain about the quality of service they receive at our health services, our health facility. And so for now, it is important to understand what quality is. We have mentioned, if you mention quality, satisfaction, what is it? So I know you understand what quality is about, but let's go through and know what goes into quality and the different perspective of stakeholders about what they expect to be quality. So quality means different things to different people. But for me, what I would term as quality might be different from what you also see as quality. Some patient, when you go to the hospital, oh, how care did you receive? They gave me health insurance medicine, so it means they were not satisfied. Oh, I waited a long time. Nobody was looking at for no promptness of what services. So it means this person was not satisfied. Okay, I was given a lot of infusions. I was sick. Oh, you see, then that person is satisfied. So, so as I was saying, quality, it means different things to different people. But the main ingredient or the common element is the degree to which a product or a services meets the expectation of an individual or a group. So when the service you are satisfied with what you were given, that is what you term it as what quality. So let's go through some important definitions of quality. In an economic dimensions, quality is the extent of accomplished relief case with justified use of means and services. And Bill Convey also defined quality as development, manufacture, administration, and distribution of consistently low products. But here in Ghana, when you sell low products, they will tell it as what it's not good. But our main is to ensure quality you can afford. So affordability is also what equality, but it's good. So low products and services that consumers need and want. Government and those who pay of the care would see quality as weighing out between results and the costs. So what you have paid, and did you get the results of what you have paid for? So government and those who pay for the care will see quality as weighing out between results and costs to fulfill certain expectations in health care. ISO 9000-2000 defines quality as the degree to which a set of inherent characteristics would fulfill requirements of an individual or a group. And when you come to healthcare quality, what is healthcare quality? So we have the Institute of Medicine. They define healthcare quality as the degree to which what health services for individuals and populations increase the likelihood of a desired health outcomes. Yes. And they are consistent recurrent professional knowledge. And so in a healthcare perspective, again, quality can also be defined as the extent of resemblance between the purpose of healthcare and the truly granted care by donor burden. So in healthcare, we need continuous improvements in quality. This is necessary because expectations might change. So we don't only improve for a specific period. No, it's continuous because, as I said, expectations might change. What meets today's expectations may not meet what that of tomorrow. Things are changing, technological changes and all those things. So we also want to improve our system, our care or whatever continuously. So quality is not what just satisfying, but delighting the customer by continuously meeting and improving upon agreed requirements. So why do we need quality? For customer satisfaction and happiness, for goodwill, that is the image of the organization, and high productivity. If people are talking positive about us, we'll be happy. This hospital, don't go there. If you go there, you die. That is not the, we are not raising a good image of the hospital. So we all need quality so that people will talk about positive things about what we do. Capturing the markets, yes. So you see that this hospital, people are going there. If I'm sick, I'll go this because of what the services that they are rendering. And it is delighting the customers. So minimizing the cost as well, maximizing the profits, recognizing the role of everyone in the organization. Yes, we need quality. That's the So we need quality for fixing a common goal for the entire organization, emphasizing teamwork among the staff and establishing performance measurements for the employees. And also for the betterment of employees and increase viability. So that is quality. These are the key dimensions of quality. So we have safety, access, equity, the amenities, technical competence, efficiency, effectiveness, patient-centeredness, continuity of service, interpersonal relationships in healthcare, and timeliness. So these are some of the dimensions. So safety, we all need safety. So avoiding harm to patients from the care intended to help them. So we need to avoid harm. So that is safety. Ensuring that procedures, medications, and treatments do not cause what injury or adverse effects. So that is safety. Then, yes, Edwin. Hello. Okay. So these are some of the examples.
Hello, madam. Please, your
Yes.
voice is breaking.
But is it okay now?
Please, your voice is breaking.
Hello.
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 Can you hear me?
Yes, please.
Good. Okay, so let's continue. As I was saying, the key dimensions, I say safety is part of key dimension. All need what? Safety. Not only about the patient, but even nurses, we also want safety. So safety means what? We need to avoid harm to participants from the care intended to help them, but not to what? Harm them. So we need to ensure that procedures, medications, and treatment do not cause injury or adverse events to the patient. And we also, healthcare providers, too, we also need to be what? Protect ourselves. So proper medication administration and infection prevention, these are our examples of what safety. Effectiveness is what? Providing services based on scientific knowledge and the best practices that we are supposed to do. So ensuring that care interventions achieve the desired health outcomes. So that is what, so effective. So our care should achieve what? A desired health outcome, positive outcome, using evidence-based guidelines for maternal care. There's an example. Efficiency. Whatever resources that we have, utilizing the resource to provide positive outcomes. So delivering healthcare service using the least number of resources without what? Compromising quality. Reducing waste of supplies, times, and effort, but still we are what? Providing quality care. So streamlining patient flow to reduce waiting times. That is efficiency. Then patient-centeredness. Now the focus is the patient and not the task. Not necessarily focus on task, but task, we are doing the task, but the task, when you are doing the task, it should be focused on what? Patient, but not that we are supposed to do the task, so we do it anyhow and leave. No. So providing care that is respectful of and responsive to individual patient preferences, their needs, and their values. So when you are doing this kind of care, we need to involve patients in decision-making regarding their care. Example is what? Offering birth plans and involving mothers in delivery options. Timeliness is what? Reducing delays. Yes. So timeliness is very important. Prompt attention. So reducing delays in receiving care that can cause harm or discomfort. So that is why people will not come to the hospital and they wait until the condition is what? Worsening or severe, because they don't want to come and waste time there. Sometimes, when the man hours that they can waste, they can use it for their farm, go and read and all those things. And they come to the hospital, they spend at least 1 hour, 24 hours. I mean, it even happened to me. I went to the hospital, I spent almost 24 hours. Even when I came home, I was even sick. I wasn't the one who was sick. I sent a child to them. But when I even came, I was sick. So we need to reduce delay, ensuring prompt attention to emergencies and critical conditions. Not only about that, even all the conditions. How do we streamline this? So quick response to maternal complication during labor, and providing care that does not what? Vary. Equity. Not vary in quality based on what? Personal characteristics such as gender, ethnicity, geographic locations, or socio-economic status. You need to ensure fair access to healthcare service for all patients. So offering the same quality antenatal care to women in rural and urban areas. So as we move the journey of quality, we have various perspectives of quality. And who are the various stakeholders? So quality in healthcare can be viewed from different perspectives, depending on who is defining or evaluating quality. Here is the healthcare and whoever. So these are the different stakeholders in healthcare. Yes, we're talking about healthcare. So the different hosts, you have the patient. Yes, they are the consumer. So patients or clients, they are the consumer. So we look at their perspective. What do they think about quality? Then the professional, we are the providers. We are perspective. What do we think about quality? Management, what do they think about quality? What is their perspective? Organization and institutional as a whole, the institution, what is their perspective? Community or societal perspective. We can also look at regulatory and legal perspective. So I have about 6 perspectives of quality. And each of these groups or stakeholders may have different attributes or dimensions of what quality, and about different aspects of structure, process, and outcome of each healthcare. So the patient, what do they expect? Patient, what do they expect? Patient. So from the perspectives, patient perspective, quality means what? Satisfaction. See, they are satisfied with care received and how well their needs, their expectations, and comforts are met. So what they expect, they want the healthcare personnel to respect and dignity. So that is what, when you respect them and treat them as human beings, they are satisfied. When there is a communication is therapeutic, they are satisfied. When there is what? Compassion and empathy, they are satisfied. When there is what? Prompt care, yes, timeliness, they are satisfied. And then there is what? Clean, yes, for me, clean and safe environment. I like it. I am satisfied. But when you go to the hospital and it's not clean, the toilet is not clean, there's no bathhouse, it's not satisfied. So these are the patient perspective. And the example is what? Nurses explaining procedure clearly to patients, prompt responses to patient call bells, and what? Respecting patient privacy during. That is what the patient perspective is about. They want what? They want to be satisfied with care received, satisfaction. So that is why it can be evidence-based. So that is why you always say some topics of patient satisfaction with healthcare. So these are the perspective of patient. When you come to the professional perspectives, from the professional perspective, quality means providing care according to scientific knowledge, professional standard, and ethical principles. So key evidence is what? Evidence-based practice, as you do in the hospital and as you do your research and all those things, is evidence-based. Based that you can provide quality care, adhering to standards. And in nursing, we have our protocols, we have our guidelines, SOPs, and we have our standards. Competence and skill. We don't want the nurses and midwives and doctors who are not skillful, who are not competent. They will kill you. So ethical and legal practice, you practice in accordance with what? Legal and ethical, ethics. So we need what? Correct medication, administration using the right of what? We have the right of medication, following standard, wound dressing techniques. How do we go through for wound dressing? Some say in, some say out, but we have the protocol. You need to follow the protocol, the standards. Maintaining accurate nursing documentation. So these are also health professional perspective of quality. Then from the management perspectives, quality focuses on what? Efficiency, productivity. So efficiency, productivity, and optimal use of what? Resources while maintaining acceptable standards of care. So cost effectiveness, efficient use of staff and materials, meeting organizational goals, and compliance with policy. An example is proper staff scheduling to avoid shortage. Yes. Reducing wastage of medical supplies and monitoring nurse-patient ratios. This is from the administrative, management administrative. It can be in charge of managers and DDNS there. Then with organizational or institutional perspective, so from the organizational perspective, quality is about the overall performance, yes, and reputation of the healthcare institution. And so accreditation and certification, yes, you meet accreditation purpose, the hospital is accredited, satisfied, compliant. You need to comply with what? The regulatory bodies, do this, do this, do this. Then risk management and continuous quality improvements. Example is what? Preparing for hospital accreditation inspections, implementing infection control programs, participating in quality improvement committees, and all those things. Then when it comes to the community, on the society, their perspective, from the societal perspective, quality refers to how well the health system meets the health needs of the population in a fair and equitable manner. So equity and accessibility to healthcare services, public health outcomes, cost to society, and ethical distribution of what? Resources. So with this, providing what? Equal nursing care regardless of socioeconomic status, participation in community health programs, and we do it. Then we have health education and disease prevention activities. We do it, the communities as well, health talk and all those things. Then the state dimension or perspective is what? Regulatory and legal perspective. So from this perspective, quality means compliance with what? Laws, regulations, and professional standards set by regulatory bodies like NMC, Ministry of Health, Ghana Health Service, and all those things. So the key aspects, we focus on licensing. You need to get a license requirement to practice. Then legal accountability, professional standards. So as our professions, you need to operate within the standards of the organization. Then the patient rights also there. So practicing within what's the scope of nursing practice? Yes, you are a nurse or nurse assistant. You don't behave like a doctor. You are so some. There was this student. It was a nursing student, but the tobacco use So practicing within the scope of nursing practice, proper documentation to meet legal standard, adhering to nursing council guidelines. So this is the perspectives of quality. I have about 6 perspectives: the patients, the healthcare provider, the manager, the administration, and all those things, up to the what? Regulatory and legal perspectives. What is quality management? So all that we have done is what? Quality, and different perspective of quality. What is quality management? So quality management is the art of what? Overseeing all activities and tasks that must be accomplished to maintain a desired level of excellence. So that is quality management. So everything we do is about management and leadership. Quality management. So this includes what? The determination of quality policy, creating and implementing quality planning assurance, and quality control and quality improvements. It also refers to as total quality. So quality management is focused not only on quality, but also on the means to achieve quality and sustain total quality. Management is so it consists of planning, organizing, and we have done that. So in general, quality management focus on length and long-term goals through the implementation of short-term goal initiative. And these are the objectives of quality management: to improve the overall quality of nursing care, to ensure patient safety and satisfaction, to promote evidence-based nursing practice, to reduce errors, complications, and wastage, to improve efficiency and use of resources, to encourage teamwork and accountability, and to ensure continuous quality improvements. So these are the objectives of quality management. The component, we have the components: quality control, quality assurance, and quality improvements. Quality control, quality assurance, and quality improvements. So what is quality control? The first component of quality management, we have quality control. What is it? It refers to the activities that's used to evaluate. So without the control system, things will not go on well. So the activities that used to evaluate, monitor, or regulate services rendered to consumers, that is quality control. Quality control. And this is the objective of quality control, to decide the standard of quality, yes. So the checks that are available to help improve what? Quality or nursing practice. So to decide the standard of quality of products, yes, which is easily acceptable to the consumer. So this is a check to verify whether the product conforms to the predetermined standard, to take necessary steps so that the products which are below the standard do not reach what? The customers. So we have the Food and Drugs Board, we have this, we have various policies that guide us about the standard. So without the quality checks, the control, things will not move on well. So that's we had a system. So that is one component of quality management, quality control. So to take different measures to improve the standards of quality of products, then to develop quality conscious in the various sections of the manufacturing or the. So the hallmark of effective quality control is what the program is support. We have support from the top level administration. So they bring all those things so that we can also follow it strictly. Commitment by the organization in terms of fiscal and human resources, then quality goals reflect search for excellence, yes, rather than minimums. We don't want this. We want to strive. That is why we said the quality should be continuous. Quality improvement. We shouldn't stop. What meets today's expectation, but will not meet what the future expectation. Things are changing. So the process, I said, the process is what's ongoing. Things are changing. It is continuous. So these are the quality control process. Establish control criteria, identify the information relevant to the criteria, and then you determine ways to collect the information, collect and analyze this information, compare collected information with the established criteria and make a judgment about quality, provide information, and if necessary, take corrective action. Yes, as I said earlier. Regarding the finding, then you need to also re-evaluate if things are not well done. So that is the process of quality control. And what are the things for collecting quality data? So audit is what? You have the nursing audit. It's a systematic and official examination of records, process, structure, environment, or accounts to evaluate our performance. So that is the audit. So we do nursing audits in the ward. So auditing in healthcare organization, it provides managers with a means of applying the control process, the process that we have just discussed, to determine the quality of services rendered. So with the two, you have the types of the audit that we can use to achieve our goals. So we have the auditing can occur retrospectively, concurrently, or prospectively. So prospectively, with the retrospective audits, they are performed after the patient receives what? A service. So when you receive when you are going, we can ask you some of the things that you observe in the hospital. So that is retrospective. But concurrent is when the patient is still there, you can get the information. So they are performed while the patient is receiving the services. Then the prospective audits. This attempt to what? Identify the future, identify how future performance will be affected by current intervention. So that is prospective, the future things. So these are some of the tools that we can use in quality control. We can have outcome audits. We can also have the process. So the audits most frequently used in quality control in nursing, we have the outcome. We need the outcome, how we do things, that the process. So the outcome audits reflects the end results of care or how the patient health status change as a result of an intervention. Intervention is what? The care that they receive. Then the process, they are used to measure the process of care or how the care was carried out and assume that a relationship exists between what? The process used by the nurse and the quality of care. We provided, that has been provided. And the structure audit focuses on the settings, on the structures, on the settings in which care takes place. This includes your resources, inputs such as the environments in which healthcare is delivered. These are all can be affected in what the quality control. So with the quality control, that's the quality control, one component of quality management. The other component is quality assurance. Quality assurance. The quality assurance, this field of quality assurance is an old as what? Modern nursing. And for Florence Nightingale introduced the concept of quality in nursing care in 1855 while attending the soldiers in the hospital during the Crimean War. So what is quality assurance? Is planned, systematic activities ensuring that services conform to established standards. So we talk about the standards here in quality assurance, and the control is the texts that are there to So quality assurance in healthcare. Quality assurance in general is planned, systematic activities ensuring that service conform to established standards. But in healthcare, it's also planned, systematic approach for monitoring, measuring, and improving quality of health services with available resources and one to meet the expectations of both worlds. It's not only about, we are not about delighting only the users, but the providers as well. You can also define as what? Nursing practice through well-written nursing standard and the use of those standards as basis. So we are most conscious about what? The standards. And we need to meet the standards as basis for what? Evaluation or improvement of client care. So that is quality assurance and quality assurance in healthcare. So quality assurance involves identifying the standard for excellence. So we here, the standard is the protocols, the SOPs, and all those things that we use. So standard of care. So we evaluate care against the standards that are there, taking action to correct any deficiencies and to reach these standards. So basically, it focuses on the clinical aspect of the provider's care, the process, often in response to what identify problems. So many quality assurance activities, they focus on the process standards. So the documentation, how was it done, this adherence to practice standards. And these are the 5 principles of quality assurance. is primarily what oriented towards what meeting the needs of the clients, the needs and the expectation. So that is our quality of the patient and the community. And it focuses on what, as I said, the process. We are very interested in the process, system and the process. And it uses data to analyze service delivery processes, and it encourages team approach to problem and quality improvement. Communication is what is vital to success in quality assurance. So the process is about you set quality standards based on national international guidelines. So the guidelines, the protocols, and all those things are brought by the national. So we need to set quality standards based on the national, the international guidelines. We develop policies and procedures to guide our practice. So when you go to the world, you need your, here in the world, this is our policy for wound dressing, this policy for this are policy for infection prevention, this are policy for wound medication, these are policies for, we all have all those policies, and we are supposed to also follow the policies strictly. Conducting regular audits, for the audits that we talk about, and performance assessment, monitoring patient outcomes and service delivery, and implementing corrective measures to address these gaps. So we have the structures and organizations for quality. So in quality assurance, the organizations and the structures must involve every department. It's not only about nursing department, all those teams. So every department in healthcare, we need to all come on board for quality assurance. It's not about nursing care or med pharmacy, all the teams, all the departments in the organization. So effective leadership and commitment is the key to sustainability and success of quality assurance. So as I said, we have all the departments. So these are the structures for quality assurance. So with the national level, what do? They develop policies and strategies. They produce clinical guidelines and protocols. Yes, they set national standards. The standard that we are talking about, they set it. They provide technical support to regional quality teams. They compare and ranking performance of facilities. We don't do that. These are all quality assurance measures. Compare and ranking performance. Sometimes we perform in Ashanti region, they do there. So that's who is the best hospital, who is the best nurse, and all those things. They are all things to assure quality assurance. So comparing and ranking performance of facilities using a set of quality indicators, then monitoring. We'll go through monitoring. At the regional levels, provision of support through facilitations, coaching, monitoring, and supervision. And at the district level, we promote quality assurance or awareness. We monitor the performance of facilities. Then we encourage high performance by comparing institutions and promoting our best practices. And at the facility level, so the quality assurance team at the facility level is multidisciplinary. responsible for what? The implementation of the KOI by the national and the whatever. So they coordinate, their key responsibility include coordinating and providing guidelines and information to the heads of what department as to what they're supposed to do, promote quality assurance awareness. Promote quality assurance awareness, conduct exit interviews, then analyze the use of quality data at the facility level and identify quality problems and draw action plans to address them. So how do we develop standard? You know, I said about standards. We follow protocols and standard. That is quality assurance focus on standards. And standards are what? They are explicit statement of expected level of quality. Yes, that is standards. And the standards, they provide basic measurements against which performance can be what? Assessed and compared. So as I was talking, I talk about standard, quality assurance standard. How do we meet the standard? So the standard for practice define the scope, yes, and dimensions of practice. And the standard for nursing practice define nursing care outcomes as well as what nursing activities and the structural resources needed. And we have various professional bodies that have also what about the standard. And the ANA is there. We have the NMC also, so they produce those standards, the guidelines. So you can look for, so standard have distinguished what characteristics. They are predetermined. It is established by an authority by like ANA, NMC, and the like. So various professional groups can also produce the standard, communicated and accepted by the people affected by them. And so because standards are used as measurable too, they must be objective, measurable, and achievable. If you make the standards that you cannot use it, then there's no need for standards. So standard must be must be objective. So it must be measurable and so we need to measure it and we must achieve our goals. So these are the forms of standards. Standards include what? We have the performance standards, the clinical guidelines, there's a standards, the protocols, they are all standard. That is why I said we should all stay within what's the standard of practice or the scope of practice. Specifications are standards, standard SOP, that is standard operating manuals or procedures. They are all standard. They are all in the words when you go there. The word. Then the records, they are all standard. So what is performance standards? The performance standards define specific criteria for what measuring the outcome of service, the performance, how the service was performed. Example, they are used to measure compliance with guidelines and to evaluate our practices. We want 0% of what TB cure in this year. Within the 5 year, maybe long term, we have eradicated this. So are we performing? So if we are not able to meet our goals, it means what? We are not performing. We want 0% in COVID-19. Or we want people to have the injection. About 90-something of Ghanaians should get the COVID-19 vaccine. Did we reach our goal? So that is performance standard. Then the clinical guidelines or protocols. These are statements that describe how specific clinical procedures should be carried out. So they guide health workers in making diagnostic decisions, yes, and taking actions to address specific healthcare conditions. So that is a clinical guideline. It is there when you go to the world. They review it every year or every whatever. They review these guidelines, the clinical guidelines and the protocols. Then specifications, they are guidelines that specify the characteristics of what a product or material. Input like equipment and supplies needed to support healthcare delivery. For example, specification of X-ray machine. We want this type of X-ray machine. The specific, it should this, it should be this, it should be this. This is specification. Well, I want this type of phone. The specs, it should be this, this, this. So this is specification. X-ray machine, autoclaving this, then you need to satisfy. Then also have the SOPs. It states the best practices. So get the SOPs. When I was in the world, I can't remember the SOPs were, I think the yellow, blue. It was covered in blue. I don't know now if they've changed the cover. So it states the best practices for management and what administration. So even the doctors, they also have so when they are even conducting the ward rounds, they have this guide with them. So they refer to, this, it might be this. So they refer to and they are able to make their diagnosis. Then we also have the records that provide objective evidence of performed activities or achieved results. So these are the forms of standards that we have. So after we have done with the standard, how do you disseminate? How do you let the people know that these are the standards that we have developed, or these are the protocols, the forms of standards that we have developed? You need to launch them. Yes. You also need to train people about how to use the standards. Then you also have some seminars to let them know about the standards. Then you can also write circulars to the various management, the in charges and everybody, so that this new standard is there. How do you go about it? Then there's also monitoring and supervision about the standard that we have. So once the standards they are developed, it is important they are circulated widely and their use is what promoted. So we can do this to let people know about the standards that we have brought. So the uses of standards, just standard, they are used to define quality. Yes. Standards are used to determine inputs, process, and desired outcomes. And standards are used to develop indicators to measure and monitor what quality. Standards improve performance of healthcare workers. Standards helps in self-assessments, is for supervision for regulatory or accreditation purposes. So that is standards. So what are the role of the manager in implementing quality assurance? Manager will lead in the formulation of appropriate policies, guidelines, and strategies. He or she will be directly involved in the planning and implementation of the quality assurance activities. He or she is willingly commits the necessary resources to quality assurance. He facilitates the development of quality indicators and standards and encourage training of staff, then set up monitoring, review, and evaluation systems, and improve the technical and management skills of our staff. And he leads in the improvement of internal and external customer relationships, then establish effective communication system. This is the role of manager, healthcare manager. What about the client? What are the role of clients in quality assurance? There, yes, of course, the clients are the definers of quality. So without the clients, what's the quality for? So clients are in the best position to say what constitutes quality to them. So based on that, we channel our reforms to this. So they are evaluators of quality. They evaluate the quality. They are called upon to evaluate quality in client satisfaction survey, as you do in your research. You go to the clients, you want specific things, then they evaluate it. So you get your data from them, you question them, and you get information. And based on that, you'll be able to formulate whatever you want in the end product. So they are called upon to evaluate quality in client satisfaction, the surveys, the research, and all those things, clients, complainant, and suggestion system. They are co-producers of quality. So by agreeing with providers on how to care for themselves and by participating in what respective activities, they are targets of what quality assurance. The main focus of the effort is the client. So they play the role They are reformers of health services. So based on whatever we get from them, then we can use to formulate our policies. So health reforms meet clients' expectations. So these are the rules of clients in quality assurance. They are definers of quality, evaluators of quality, co-producers of quality, targets of quality assurance, and reformers of health services. And these are the benefits of quality, good quality. So quality assurance is important because poor quality is costly and good quality is beneficial. And quality assurance is beneficial to everybody, the client, the community, the healthcare staff, healthcare managers, and the institutions. So these are this. So the benefits to good benefits to users, less frustration. Yes, when they receive prompt treatment, there's less frustration. When there's an optimal use of what money, what I've gotten what I good health outcome and satisfaction. To the providers, there's job satisfaction, yes. They enhance dignity and pride, low complications, less frustration, low infection rates, better understanding of staff by client, availability of essential input. So these are the benefits to the users, to the providers. Then to the healthcare manager, there's limited errors in the health facility. There's efficient use of resources, while high utilization of services, good reputation of the organization, competent services, yes, by their care providers, high patient services, and high staff satisfaction. So the institution, the health institution, it has high staff retention, high utilization of services, and it also meets accreditation purposes or criteria, high patient and staff satisfaction related to what? Good reputation of what? The organization. But when we have poor quality, what does it do? So poor quality can also result in costs. Some of which are readily visible, you can see them, and others not readily so visible. So costs that are obvious, wrong diagnosis, you can see that when there's wrong diagnosis, patients keep on coming to the OPD. When there's wrong treatment, when there's prolonged illness, it means that the quality. It doesn't mean that's okay because but some to that extent, some extent, you can mean that, oh, it's not all cases that it's prolonged that we can say that it is not, it's a poor quality, no. When there's a repeated OPD visits, you can see that what is treatment as this person, then we need that even the doctor will say, let's do a thorough whatever, so that we can see what is causing this person to be coming to the hospital frequently. High expenses to clients and poor utilization of service. It can also lead to death. Yes. The costs that are obvious, that are not obvious, invisible, wasted lab tests. You cannot see it brightly, but it's there. Unnecessary treatment, wasted medications, poor patient compliances, wasted health worker time, wasted patient time. Frustrated patients, loss of community trust in the hospital, late presentations, because they see that when I come to the hospital, this is not. So let me wait, let me go to here, let me go to the over the counter, let me go here. And by the time they realize the disease has gone to a stage where there will nothing will be done. So poor cost recovery and low health worker morale. And these are the barriers to quality assurance. When there's non-commitment of top management to quality, there's a barrier. There's wrong attitude of staff to quality, to standards, lack of teamwork, concept of quality poorly understood, fear of change, what change can bring. So these are the barriers to quality. So the third component is quality improvements. Quality improvements. So what is quality improvement? So quality improvement activities have been part of us. What is it? It involves what? Quality improvement involves continual analysis and evaluation of products and services to prevent errors and to achieve customer satisfaction. So that is quality improvements. So quality improvements, example is what? We can have several terms like total quality management, Six Sigma, continuous quality improvements. They are all used to describe quality improvements. You know, quality assurance models seek to ensure that quality exists, whereas quality improvement models assume that the process is what? Ongoing quality improvement, and quality can always be improved. And this is done by Damien. Edward Damien refers total quality management as what? Continuous quality improvement is a philosophy developed by what? Damien. As I said, the work of continuous quality improvements never stops because products and services can always be what? Improved. And these are some of the aspects of healthcare improvement to evaluate. We need to improve the structure. We need to also can evaluate the process and the outcome. And we know what the structure is about, what the process is also about. And what the outcome. I also have so the structure refers to what we have gone through the structure, that is the setting in which the care is given, and to the resources. So input or resources that must be supplied for the activity to be carried out. Example, materials, equipment, infrastructure, human and financial. These are all part of structures. So the setting in which the care is given and to the resources. So what is the process? It describes what steps or the way activities must be carried out by the healthcare providers and all the decisions made while a patient is what? Interacting with the organization, conducting an example is conducting an immunization. So it's a process. And the outcome describes the result or output of the activities carried out. Example, percentage of children was immunized. So that is a process, conducting an immunization session. And the outcome means what? So we need quality improvements here. We always ensure that things are improving. We don't stop. So the outcome, the question that asked during an evaluation should measure observable behavior such as the wound was healed, blood pressure within the normal, is the outcome. Then even when you come to the family, it's increased time between visit to the emergency department, applied for foods, whatever. Then the team, decisions reached by consensus, attendance to at meeting by all team members. These are all outcomes. So these are some of the quality improvement models. We have you do it, you plan, you do, you check, and you act. Plan, do, check, and act. Okay, so that is you plan, you do, you check, and you act. So when you plan, you plan a change and it tests to determine if process modification is beneficial. When you do it, you need to implement it. So implement the change and its test on a small scale, then assess the test results to determine what was learned and determine whether to adapt the change, abandon the change, or repeat the PDSA cycle. The PDSA cycle is plan, do, check, and act. So PDCA cycle, that is plan, do, check, and act. Okay, so that is the quality improvement model. And so what is the steps? So it's the steps of quality improvement is to identify a need. So identify niche most important to the consumer of healthcare service. Then you always want to improve it. You assemble a multidisciplinary team to review the identified consumer needs and services. So this is you collect data to measure the current status of these services. Then you need to establish measurable outcomes and quality indicators, select and implement a plan to meet the outcomes, and collect data to evaluate the implementation of the plan and the achievement of outcomes. And these are the tools and techniques in quality assurance and quality management. We can use checklists, we can use flowcharts, we can use root cause analysis, we can use a fishbone diagram. We need to analyze, that is the cause and effects. Analyzing factors leading to issues. Then you can also use plan, do, study, act. So the PDSA, to do, to plan, and then study act, or the cycle. So testing and implementing changes. So that is quality. So as I was saying, monitoring is very important. All this quality assurance and all control, you need to monitor it. You need to monitor. Quality monitoring is a collection, analysis, and interpretation of data in order to assess whether we are making any progress. So all the components that we have talked about, when you don't monitor it, then quality cannot be achieved. So data for monitoring quality may be data collected routinely. We have the OPD data, attendance, mortality rate, and all those things, or periodically on selected quality indicators. Based on patient waiting time, you can monitor it. Based on that, you can improve it. And so these are the key steps in quality monitoring. You identify the key processes and activities within your setup, prioritize processes and activities to monitor it. Determine your scope of monitoring, what, where, and when to monitor. Develop performance indicators, develop appropriate strategies or methods for monitoring, then compile and analyze data. Initiate the quality improvements process. These are methods for monitoring quality. We have the client satisfaction survey. You do it. We have staff satisfaction surveys. We have record reviews. We all use this. Clinical audits, the audit that I've talked about. Then we can also review of what adverse incidents. We have that on the watch. We have done that. I think we have published this one. Review of adverse incidents. You have the adverse incidents on the watch. So each watch, sometimes you can review it. You can use it as a research evidence base. Patient complaint system. When you go to the ward, we have some boxes placed on the walls. Label it what patient complaint system. We need to let the patient put their complaints there. These are all type of data collection for monitoring quality. These are all methods. Then facilitative supervision is also there. So these are all methods for monitoring quality. And these are the tools for monitoring. We have talked about the inputs, process, and output indicators. So what is quality indicator? An indicator is a yardstick by which you measure progress. Yes. So all that we have done, as I said, we need monitoring. So selection of indicators must be based on what you set out to do. Yes. So what do I want to do? I want to go to patient waited time at the OPD. It's an indicator. So this is what I want to go and improve. So the quality indicator, as I said, is the focus of quality improvements program. So with the staff monitoring criteria, that will show whether indicator standards have been met. We have the 3 types of indicators. The input indicator, it helps you to monitor whether you have put in appropriate and enough resources. On the process indicator, evaluate the manner in which care is delivered, helps to assess whether activities are consistently performed in the appropriate sequence, timely in cost-effective manner. So these are the all process indicator. Example, the process of pain assessments, recovery of clients from sedation, patient waiting time at OPD, and client referral to the community. They are all process indicator. Then the output indicator helps you to determine whether you are achieving the coverage of or target sets. Example, I have this percentage cure rate, 99% cure rate for COVID-19. Did you achieve it? And these are the roles of a nurse and midwives in quality management. You need to follow protocols and ensure compliances, identify, reporting, and addressing errors, participating in quality improvement programs, advocate for patient safety and quality care, educate patient and junior staff on quality standards. And these are the challenges in quality assurance and management. There's limited resources and inadequate funding. Yes, even on the walls, we see that there's a lot of things we improvise. There's resistance to change in established practices. There's insufficient training and lack of knowledge, but now we are doing well. But still, it should be consistent. Poor communication and teamwork. There's absence of standardized quality, the process. And these are some of the strategies for enhancing quality. You need to strengthen the policies, the procedures, and the standard guidelines. Let them use it. If you don't have it, go for it as a manager, as an in charge. Let your staff get them. Offering continuous education and professional development, as you are doing now. Promoting teamwork and interdisciplinary collaboration, leveraging technology for data collection and analysis, and encouraging patient involvement in quality improvement. So indeed, the principles and processes of quality improvement can be applied to our family life and even to the life of an individual. So nurses and midwives play a critical role in maintaining quality. So continuous evaluation and improvements are key to achieving excellence. So in summary, poor quality causes loss of customers, loss of lives, loss of revenues, loss of maternal resources, loss of time, and loss of what? Morale, loss of staff, loss of trust, loss of respect, and loss of what? Recognition. So we must also remember that quality improvement is not peculiar to healthcare, but has been applied and continues to be applied in business, commerce, and industry. Okay, so the end. If you have any question, I am preparing to go for a funeral. So that is the end of today's lecture. What is today's date? I said. So that is the end of the lecture. Have a nice weekend. Or do you have any problem? Hello?
Hello, doctor.
Yeah. Have you shared the
Yes,
slides?
repeat. Yes,
Did you
doctor.
use some today? Today,
Yeah, we kept this on the
you are B, right?
we are
Or A.
B. Yeah, we kept this on the B.
So have you sent it today?
Yeah, we kept this on our platform, the first platform.
Edwin, you are talking.
Yes, doctor.
Is it Edwin? Huh?
Yes, yes, doctor.
Oh, Adrian, last time I was so busy and I was just talking to you. I was talking to somebody. It wasn't you. Okay.
Oh, okay, sir.
Yeah. That's when we're wearing. But you have the slide, so I also share this one. So it wasn't you. It wasn't meant for you. I was talking to the and I was also having a meeting.
Oh, okay.
So I'll send this one to you. I'm supposed to go for
Okay, doctor.
okay. So if you don't have any questions, so let's end and we'll meet. Hey, next week is what's next week date? Let's see next week. Next week is what 13, 14.
14th. Yes,
I'll be
doctor.
around. I'll be around. 13, 14, I'll be around. 20th, okay, yes. It's only about the 27th. And I'll see what we can do. And we need to share the assignment as well, presentation, so that you prepare.
Okay,
Okay.
doctor.
So yes, I will prepare it and share it with you.
Okay.
Good. So have a
Thank
nice
you.
day. You are
Have a
welcome.
nice day, sir.
I'll share this one. So when I share this one, please, as you have done the first one, share it with other groups, okay?
Okay, doctor.
So when are we having the mission? What we don't have the date.
We'll
We
check
don't have
from
the date.
the academic calendar. No, we'll check from the academic calendar and communicate it to you.
I check it because I don't have it.
Okay.
Thank you.
Welcome.
You're okay.